for my mental illness presentation, I chose bipolar disorder, and the picture I chose for the first slide is someone that seems to actually have bipolar disorder, and then someone saying, I'm a bit bipolar too. I chose this because in the media and sometimes in just the language that we use every day, people can say, oh my gosh, she is so bipolar, or I'm feeling so bipolar today, when we just have regular mood swings that are very normal, but that's not the entirety of what bipolar disorder is at all. Okay, so what is bipolar disorder exactly? It's a mood disorder associated with mood swings between week or month-long episodes of depressive lows and manic highs. It's also known as manic depressive disorder. So there are two types of bipolar disorder, bipolar 1 and bipolar 2, and this is just a picture of a healthy brain and a brain of someone with bipolar disorder. Okay, so the difference between bipolar 1 and bipolar 2 is the severity of mania that the patient experiences. So this is just kind of a chart to visualize what this means exactly. So as you can see, the normal mood is the middle, and hypomania is above the normal mood but is not as high as mania, and then there's obviously the depression on the other end. So bipolar 1 experiences mania and obviously the severe depression, and bipolar 2 only experiences hypomania, which is not as severe as normal mania. So just again, the patient with bipolar 1 can experience full manic episodes with less severe hypomanic episodes, and a patient that has bipolar 2 can experience less severe hypomanic episodes, and this just depends on the severity of their symptoms and how many symptoms they have and for how long it is. Hypomanic episodes usually last for just a couple days to a week, while full-on manic episodes can last from weeks to months. But they both experience major depressive episodes and have periods of heightened mood and states where they are symptom-free. This is just the DSM-5 classification for bipolar 1, which can get a little complicated because it's based on the severity of the symptoms and what episode the patient is currently in. But for bipolar 2, it's just 296.89 for everything. And there's also 2,300,000 Americans living with bipolar disorder every day, which is a large number, and a lot of people experience this disorder and have to live with it in their daily lives. I just chose this video clip from the show Shameless to portray the symptoms of someone with bipolar disorder. A character in the show, Ian, suffers with bipolar disorder, and this is just a portrayal of some manic symptoms.
What do you think of gaming? World of Warcraft, Second Life.
What, you mean like playing them?
No, the business side of it. Online multiplayer gaming is the future. I read all about it in a magazine. Think you'd be any good at it?
I don't know.
Yeah, I think it'd be great. I got tons of ideas for games, you know. Here it is. Hey, you sure you don't want to join? 8 miles.
I'm good.
Are you okay?
Yeah, great. Why?
You seem a little caffeinated.
I quit smoking.
So, what's next for you?
Oh, I've been thinking about apprenticing with this electrician I met. You know, learn how to wire stuff.
What about high school?
Oh, Frank finished high school. Worked out great for him.
You have to finish it.
I don't have to do anything. I'm done living the way other people want me to live. I myself didn't think I could do it here.
Oh, don't you have to be 18?
Don't know, don't care. I left. Stuff got nuts.
What stuff?
Oh, military trying to control me.
Well, isn't that what the military does?
Got sick of it, but hey, I met some amazing folks. Got all these great ideas. I'm a different person. Hey, but we can talk about that later, right?
Sure.
About 5. You didn't get back from work until 3. Yeah, I went for a run this morning. I have a ton of energy. Oh, check out this sunrise. Look at that. It's crazy.
Yeah, that's real nice.
Okay, so I just have some of the thoughts and behaviors of someone going through a manic or hypomanic episode listed here. First, an inflated self-esteem or grandiosity. You could obviously tell that Ian in the video clip was very confident in what he was doing, and he said he didn't have to live for anyone else or do what anyone else wanted him to do, but he could just do what he wanted to do. They also experienced a decreased need for sleep. He said that he only slept 2 hours, but he had a lot of energy and he was like going on a run. More talkative than usual, or pressure to keep talking. Obviously in the video clip he was very talkative to his family and friends. A flight of ideas or subjunctive experience that thoughts are racing. In the video clip he was jumping from subject to subject, talking about all these different things all at once, very fast, which could represent this symptom. Reported or observed distractibility. Again, he was just super distracted and going from subject to subject, talking a mile a minute. Increasing goal-directed activity or psychomotor agitation. So obviously he was saying he was running 8 miles, so this could be considered goal-directed activity, and he was just very motivated, it seems like, and very ready to accomplish whatever he wanted to. Psychomotor agitation is actually increased activity, but it's not towards any goal, so it's just doing something to do something because you have so much energy. And excessive involvement in activities that have a high potential for painful consequences. People experiencing manic episodes will usually go on huge spending sprees or like do things that have high consequences, do crazy things just because they feel like they can conquer anything and they feel like they're untouchable. And the thing about manic episodes is sometimes they can be perceived as positive from the person experiencing them. So many people who have bipolar disorder will sometimes not want to take their medicine because they don't want to hinder their manic episodes, because that's when they feel like they can do anything and they just feel great overall. That's not the case with all. Sometimes it's just very like overwhelming and can be kind of awful. But yeah. And this is the behaviors and thoughts of a depressive episode. I have another video clip of Ian just experiencing some of these symptoms.
Hey, you okay? You okay? Feeling sick or something? Maybe a little. All right, you want me to bring you back something to eat? Yo, it's after 5. You trying to set some sort of record? You're not still sleeping. Get up.
You want to go for a run? Get some fresh air? What do you say? Okay. Okay. How long has he been like that?
Since yesterday morning.
And he hasn't gotten out of bed?
No, he's just sleeping. I can't get him up. I tried.
Yeah, so did I. What about before? What was he like?
Before he was fine. He was happy. He's staying up all hours of the night, dancing. What's wrong with him?
Depression, I think.
He's depressed? What do you mean he's depressed?
It could be bipolar disease, like our mom.
Like depression, Mick.
It's like high highs followed by low lows over and over again. We'll get him an appointment at the clinic and we'll see what they say.
No, look, he's low. We cheer him up.
It's not like that. He may have to be hospitalized.
Okay, so kind of show the other side of bipolar disease, which is depressive episodes. So some thoughts of and behaviors of depressive episodes can be a depressed mood most of the day, nearly every day, as indicated by either subjective report or observation made by others. So that means that either the patient reports that they feel this, or people that are close to them observe that they are experiencing this. So you could see, obviously, Ian was feeling very down. Marked diminished interest or pleasure in all or almost all activities. You could see he obviously didn't want to do anything. He was just laying in bed. Significant weight loss when not dieting or weight gain, or an increase or decrease in appetite nearly every day. He just wanted to lay in bed. He did not want to eat or anything. Insomnia or hypersomnia nearly every day, which you could see all he wanted to do was sleep and stay in bed. Psychomotor agitation or retardation nearly every day. As I said, psychomotor agitation is when you're just doing things just to do them, but psychomotor retardation is a slow of your emotions and reaction time, which people can experience. Fatigue or loss in energy nearly every day. Obviously, he was just staying in bed. He had no energy to do anything. Feelings of worthlessness or excessive or inappropriate guilt every day is also something that they experience, which is consistent with just regular depression. Diminished ability to think or concentrate or indecisiveness nearly every day. Like your brain is just foggy. You just can't concentrate or focus on anything. And then also recurrent thoughts of death, recurrent suicidal ideation, or a suicide attempt plan, which can obviously be very scary and concerning. So just some theories about the causes of bipolar disorder. The environment, it's more common in high-income countries and in separated, divorced, or widowed individuals. It can be onset by a traumatic life event, such as a divorce or like a death in the family or something. So it's more likely to happen with someone who has had that traumatic event than in someone who hasn't had that. And it's also a genetic thing. It's more likely in people with a family history of bipolar disorder. You could see in the clip how the characters were saying how their mother had bipolar disorder and how the son now had it, which is very common. Some consequences of bipolar disorder, a very likely consequence is suicide. It's the patients of bipolar disorder are 15 times the risk of the general population for committing suicide. But many bipolar 1 and 2 patients can return to a fully functional level of living between mood episodes with the right medication, but they could also have cognitive impairments and they can contribute to vocational difficulties. So when they're swaying between these episodes, they can have trouble with their careers. And this prolonged unemployment can lead to more episodes of depression, older age, increased rates of panic disorder, or a lifetime history of alcohol use disorder. So some avoidance, prevention, and intervention. So first off, a avoidance factor would be avoiding any life events that could offset bipolar 1 or 2 disorders, which is obviously unrealistic because trauma can happen at any time. A primary prevention is just caring for your mental health in general. A secondary prevention is diagnosing it early and being aware of your symptoms and your family mental health history. Tertiary prevention would be going to therapy or a mental rehab center, just seeking help for your mental condition. And then intervention would just be medication and a treatment plan. Okay, so treatment of bipolar disorder usually starts with talk therapy, and then moves on to different types of medication. Antipsychotic medication is usually used to treat the mania and hypomania, and antidepressants are used to treat depressive episodes, but lithium is usually used, which is a mood stabilizer, to just stabilize these extreme moods. Also, electroconvulsive therapy and cognitive behavioral therapy are used, but this is just mainly for the depressive episodes. Okay, so lastly is my case study. It's about a woman with bipolar disorder who became pregnant while on these multiple medications to treat her mental illness, which was lithium, quetiapine, and phenazine, which is a mood stabilizer, an antipsychotic, and an antidepressant. So this just posed a threat to her child, but she took care of it with special observation and care by many doctors, such as perinatal psychiatrists. And lithium is still the first and best choice for bipolar treatment of a pregnant woman, although it does pose a threat of congenital abnormalities in the first trimester. She had an induced C-section at about 39 weeks, and the baby was born twitching, but this soon stopped, and other than that, the baby was born happy and healthy. So this case study is just an example of the importance of help and treatment with bipolar disorder, and that you can prevent things that could be concerning with the right help, especially when you're on medication. And that's just my references. Thank you.